In presenting this DVD, I am assuming the viewer is familiar with standard transducer positions and movements, as well as orientation of organs on the ultrasound screen as presented in the Tips and Techniques DVD. I also encourage the viewer to optimize the ultrasound image for your ultrasound machine as described in the Tips and Techniques and General Abdominal Scan DVDs. After examining the left adrenal, the urinary bladder and prostate are the next abdominal organs to examine during a general abdominal scan. In this video, the red laser light represents the ultrasound beam. The pattern of exam portion of the General Abdominal Scan DVD presents the process of moving from the left adrenal to the urinary bladder in a zigzag pattern to examine intestines and colon in the left caudal quadrant of the abdomen. Once the urinary bladder has been located in a ventral midline sagittal position, use the transducer to fan the ultrasound beam to the patient's right side, then reverse and fan to the patient's left side until the bladder is no longer seen. In some cases, it is necessary to slide caudally and repeat the process to see the entire bladder. Rotate the ultrasound beam to a transverse position and slide rapidly cranially to find the cranial bladder wall, then slide slowly caudally to see the entire bladder in a transverse view. When finished, rotate the transducer back to a sagittal position. From the left adrenal, slide in a zigzag pattern toward the urinary bladder. The purpose of this zigzag pattern is to cover the left caudal abdominal quadrant. If you did not get a good measurement of the intestines while examining the spleen, this is another chance to get one. You should also be examining the ultrasound screen for lesions of the colon or intestines, abdominal effusions, or enlarged mesenteric lymph nodes. We will use a 16-pound cat to find the urinary bladder. Remember to keep the organ centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. When finished with the left adrenal, begin sliding the transducer in a zigzag pattern toward the ventral midline in a sagittal position. From the ventral midline, reverse directions and slide back to the left lateral side. During the zigzag pattern, the transducer is moving slowly and steadily caudally toward the urinary bladder. You should reach the bladder in 2 or 3 passes. Once you obtain a long-axis view of the urinary bladder, adjust depth to fill the screen with bladder. Reduce gain in the area of the bladder to reduce artifact. Fan the transducer to the patient's right side till the bladder disappears. Then reverse directions and fan to the patient's left side till the bladder disappears. Return to a long axis view. If you could not fit all of the bladder on the ultrasound screen, slide the transducer caudally and fan left and right to see all of the bladder. Always examine the bladder in two views. Rotate the transducer to a transverse position and slide rapidly cranially till the bladder disappears. Then slide slowly caudally, keeping the bladder centered on the ultrasound screen. When the bladder disappears, rotate the transducer back to a long axis view of the bladder.